Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with the Faculty of Offshore and Maritime Medicine with CoROM. We have two main faculty, Professor Aris Exadaktylos and Dr. Susie DiMartini, and myself. We form the faculty, and Aris is the medical director and head of faculty. Susie, you are the senior medical officer for the FOMM, and I would like to welcome both of you to the podcast.
Thank you very much, Aebhric.
Thank you very much, Rick. Thank you.
So, Dr. Aris, we'll start with yourself. Tell us a bit about yourself and what's keeping you busy.
So, once again, great to be with you and Susie on this podcast. So, my name is Aris Exadaktylos. So, if this sounds Greek to you, yes, it is Greek. And Greeks have been seafarers for hundreds of generations, I believe. So the ocean, the sea, the Mediterranean is very close to my heart. In my daily life, I'm an emergency physician, an academic emergency physician. And as you, Aebhric, fellow of the Faculty of Rural, Remote and Humanitarian Healthcare of the Royal College of Surgeons of Edinburgh, so we have a special interest in the medical care or in medical care for people in remote and rural areas. And the ocean, I suppose, is one of the most remote parts of the world, as ships are, which sail on our oceans and seas. So, that's me. I'm doing emergency medicine for the last 30 years, but for the last couple of years, I developed a very personal interest in maritime medicine, and I'm very, very proud and thankful and honored to chair this faculty. And I'm also very thankful to the University of Cyprus School of Medicine, where I'm a professor also, which supports our program and our teaching activities. So thank you very much for having me, and I'm handing over to Susie.
Hi. So my name is Isabella Susan, then Susie DiMartini, and the name looks Italian, and it is. So I had an Italian father and a British mother. So I have both passports, and I've been trained in the United States at first, where I was teaching in Philadelphia, and then back to Italy, France, and Switzerland for a while. So I started as an emergency room doctor and then a board-certified neurologist. And just in the last 15 years, I decided that I wanted a change in my life. And I started to be a ship doctor. So now I'm a senior ship doctor, having done a few world tours and at least 70 embarks. So what is a ship doctor? A cruise ship doctor provides medical care to crew and passengers, handling both routine care and emergencies. They work, obviously, in the onboard clinics, cooperating with medical staff, can be other doctors and nurses, and the ship crew to maintain health and safety. So what is necessary to become a cruise ship doctor? It is important to have the right formation, the clinical experience, and the appropriate certifications. As I was saying, we have to act as a kind of general practitioners and also emergency room doctors with some surgery skill. We have to maintain public health standards. And then that's very important because we have to write and sign a certification prior to the arrival to each port. So without that certification, the vessel cannot enter in a port. So it's a huge responsibility for the ship doctor, but we are happy to have it. And so that's why we have to be a liaison with the local health authority. And we have to take care of preventive health care. That is, for example, to have the standards in the quality of water.
I imagine you are a critical care doctor and a general practice doctor and a surgeon all rolled
Yeah.
into one.
Yeah, that's true.
So, Dr. Aris, Dr. Susie, the two of ye came to me and said, "Hey, we have this idea," and I've jumped on board. But the two of you have come up with this idea of creating the IMSD course. So we have created the International Maritime Ships Doctors course. It's a 5-day course. And you have other ideas for other ship's doctors courses as well. So I'm curious. So Aris, we'll start with yourself. Where did this idea come from? Why did you wake up one morning and say, you know what, I want to do a ship's doctors course?
So what made me interested in the ship doctor's course was, as an emergency physician, it's very natural that you're not looking only at the metropolitan hotspots, but also outside. And as a fellow, as you are, Aebhric, of the Faculty of Rural and Remote Healthcare of the Royal Surgeons of Edinburgh, um, I developed this interest to look where is training needed. Okay, where's training needed? And over the last decade, not only the need for doctors on cruise ships, like Susie just explained to us, exploded, but also the necessity for care on commercial vessels has increased. And I realized that there is basically no training. Okay, there is no training, and oceans cover the most part of our planet, and there is no training. We have training for doctors and nurses for everything. Okay, we have myriads of subspecialties, but we don't have anything which trains doctors for emergencies in such a remote environment. And nowadays, as Susie mentioned, we have cruise ships with thousands, 10,000 of souls on board, but we also have vessels stranded somewhere in the Strait of Hormuz, seafarers sitting there for weeks. And it's not only injuries, but it's also the psychological burden for people working at sea. So when I was spending my holidays, I was kind of sitting on a beach, looking at the ocean, and I was thinking, who does really take care of the people working, or just being there because they spend their holidays? But yeah, so this was my intention. And at the age of 55, I thought, yeah, after decades of urban and metropolitan emergency medicine, that's something I want to dedicate my time to for the next years. Thank you.
So I'm very interested in the passion and that both of you bring. And the two of you are a bit of a powerhouse. And something that I realized that I didn't know is how the two of ye met. Like you, the both of you and the three of us have been talking for months and months and months. I have no idea what got the two of you together.
Switzerland. Switzerland brought us together because for a while I was working in Switzerland. And so I realized that Aris were really one of the best, if not the best, emergency room doctor in Switzerland. So we met because we were following some of the same patients. And right from the beginning, Aris was really fascinated by maritime medicine. And looking on internet, I realized that I already started with a school of maritime medicine in Italy. So he said, why we are not going to make it international? And I said, of course, yes. And he said, then you have to know and meet Aebhric. And that's why the three of us are here. And we were thinking about such an important role of the ship doctor, exactly for what Aris just said, the number of passengers and seafarers are increasing on a really, really very high pace. By now, I want to recall the numbers. There are 4 billions, I'm not wrong, it's not million, billions of passengers transported by sea every year. Is half of the world population, is exactly the same number that is transported by planes. So of these, 37 millions are transported on cruises. So they decide to go on holidays at sea, while the others are transported by ferries that are also very important to be taken care of. And those are the number of passengers, but there are about 1 million of seafarers around the world, and they have to be taken care. As Aris said, the psychological impact is also very important to be considered. And by now, it's sad to say that the numbers of ILO, International Labour Organization, and IMO, International Maritime Organizations, statistically, they are reporting that the suicide rate at sea surpasses the fatal accidents at sea. And that's something that we have to take care of, absolutely. And that's an important responsibility of the ship doctor, other than taking care of the ordinary problems that the patients and crew have, and emergency problems. So we realized that there was a real need for ship's doctor to be prepared to do all these tasks, as up to now the dropout rate of ship doctor is 30%. That is very high. And why? Because some of the people of the ship's doctor, they go on board without any specific preparations. So maybe they think to be just on love boats, some kind of a holiday. But even if it is wonderful and beautiful, and I would recommend to everyone to work as a ship doctor, because you work and medicine is our passion, and you also tour the world. And also you meet a lot of people from different cultures. In Glastonbury, I had people from 46 different cultures and countries. So that's wonderful. But we have to be prepared to do so. If not, they will fail, of course.
That's amazing to think that 4 billion people take a ferry each year, which equals to the flights. And I lived in Seattle for about 10 years and Alaska. And there's parts of Alaska that the only way to get there is by ferry. So it makes sense to me that, 4 billion people take a ferry each year. 4 billion people are on a boat for extended periods of time. So we need medical cover, don't we?
Yes, those are in ferries and also in cruises, the 37 millions, and they are increasing every year. If you look at the number of new vessels that are building around the world, and also of the number of people that are transported by those big vessels, it is amazing. And then, as you know, by IMO rules, there must be one doctor every 1,000 souls on board. So 10,000 people, 10 doctors, and double the number of nurses.
10,000 people. So I deployed on the Eisenhower, the aircraft carrier, and it was 5,500 people. And it was for an Army guy to be on that. It was amazing. But it was huge. It was gigantic. 5,500 people. And that's not even half of what you're seeing on cruise liners, on cruise ships.
Yeah. And also that's why we have a complete hospital. And also the ship doctor has to be trained to check on all the lab apparatuses. We have ICUs, and also the number of the ICUs are compared to the number of passengers and crew on board. So we have ventilators, we have to know how to intubate, and we have obviously radiology, X-rays, we have ultrasound, and the ship doctors, they have to be trained for all of that, kind of super doctors.
Wow. Speaking of super doctors, so the two of ye have this idea of creating this course. So Dr. Aris, tell us what your idea, what your passion is for this 5-day course, this International Maritime Ships Doctors course, and well as other courses that we're going to put together as a faculty. But why do we need this?
We definitely need this. It's not, or let's say it the other way around. Not we are the ones who need it, but the seafarers, but also passengers on ships deserve it. They deserve the same quality of care like they can expect on shore. Now, it is not that easy. So it's not that easy to translate terrestrial medicine into oceanic practice. Okay. It's not like, okay, we do it in a smaller environment. No. You know, as Susie said, and she is the boots on the ground lady here, or boots on the deck lady here, and you are maybe hours or days away from the next place which can call itself a hospital. Okay, so it's not that easy because medicine has an answer for everything, but if you are in the midst of the ocean and you have a severe problem and there is no real intensive care unit around, you need guts, you need to improvise, and in the future, you will need the help of modern technology. So our course here, or the course we would like to provide, should give a fundament to doctors and also later to paramedics and to everyone working in such a team, because it's always about the team on board. Susie, I'm sure you will say the same, but we want to put a fundament to training, and then in the future also to support research and the implementation of the most modern and forward-thinking technology, hardware and software, to support the medical staff on board. Susie mentioned radiology, right? Radiology now is a very good example how artificial intelligence can be used to read X-rays or a CT scan, telemedicine, etc. But because we know that we cannot clone those doctors, ship doctors with passion, as Susie said, there's a huge dropout rate. Okay, it's not an easy life. You are for weeks, sometimes for months away. You live on a very, very in a very small community. It's not like if something happens with your family, it's not like, okay, I take a bus or I take a taxi. So no, you are very, very far away. And it's not only cruise ship medicine, it's offshore medicine as well, oil rigs, maritime, commercial vessels, drilling ships, etc., wind farms. They all have medical personnel. So we want to give a good fundament to everyone who wants to work offshore, and in the future to provide answers when it comes to the most modern technology. Thank you.
Great.
So yeah, you had mentioned prolonged care and improvised a bit, and Susie, I want to take my hat off to you that you do this. You do prolonged care. You do have to improvise, and as an SF guy, we Special Forces love to say, oh, we can know how to improvise. We know how to do prolonged care, but you're talking like a fortnight to get someone off your boat, isn't it? So you told me you're in the Antarctic.
Yeah.
And so how long are you taking care of this casualty?
Well, if you are, as Aris said before, in the middle of the ocean, you are out of the range of the helicopter. So you are just on your own for at least 2 or 3 days. And the same is in Antarctica. If you are just lower down in Antarctica, as it happened to me, and you have a problem, you are of about 2.5 at least days of navigation to the next hospital that is in the Falklands. And that's obviously you have to take care responsibility. That's why we have to train ourselves and continuous training to deal with emergency. That's why we have an ICU and everything. Of course, we do have to do evacuation as soon as we can. And then we do that by helicopter or by both. That depends. We become in contact with the local authorities, and then the captain with the local authorities and the doctor decide which one is the best way, whether it's the helicopter or a boat, a high-speed boat. You know that helicopters, and you know very well because you are trained on helicopters evacuations, that if the wind is too high, the helicopter cannot come, even if it's in the range of the helicopter. And so that's really interesting. And I want to stress that obviously is a teamwork always. We have to work as one person with nurses and doctors, and usually they are very good people and nice people. So and obviously we do continuous training also on board. We have exercises every week, and checking of the apparatuses, and that everything is ready to go.
So I'm curious of the vast experience you have. What's the longest you've had to treat a critically unwell casualty?
Well, the ones that we have to treat usually are strokes. Among passengers, we have a kind of an older population, and that's going to be even older and older. Because the lifespan of people is a good thing. This is longer, and the people that are cruising, especially for long journeys, such as world tours, are people that they have money, but not only money, they have time to spend on vacations. So that's also important to take care of all those emergencies like strokes. Obviously, I didn't mention myocardial infarctions because that there are a lot, and then obviously we have to evacuate it as soon as possible. All we know about the golden hours. And then there are fractures that they have to be stabilized, as you know, with fractures. For example, with the femur fractures, we have to be very careful because of the blood loss that we can have. That we'll all know about it. So that's fractures are important, myocardial infarctions, strokes, and then obviously infectious disorders.
So you mentioned stroke. So do you have a CT to confirm a clot versus bleed? And are you able to give thrombolytics within 4 hours?
So that's a very good question. No, we don't have a CT scan up to now. They are developing technologies because you know that both CT scan and MRI, they need to be on a place that is not moving. And unfortunately, the sea is moving. So for those technologies, they are a little bit back in order to be able to be used at sea. But now for the brain, I've seen that they are making that they should be ready quite soon. Some kind of, they look like a hairdresser cap that can be just used for the head. And that's very important for the CT scan in differential diagnosis between hemorrhage and a white stroke. But now what we have to use is the neurological examination and the fundus examinations and the clinical setup of the patients. If we do not have a CT scan, we have to do a clinical diagnosis. And that's also what is important also for ship's doctor, to visit people and to know how to do a clinical examination. And the fundus examination is important because obviously you can realize whether there is a edema, cerebral edema or not, with the examination of the fundus.
That's interesting. I was at a conference and talked to someone that is working on ultrasound for strokes, and they look at the circle of Willis. Is it through the ear cavity? Have you guys heard of that one?
Yeah, so it's exactly what I was saying, what I was trying to explain before Susie. The future in rural and remote medicine, so not necessarily oceanic medicine, but in general rural and remote medicine, will be a combination of still work with our hands. Okay, for example, has to put the ultrasound probe on the ear or in the ear or on the eye, supported by AI, which will help to read the image. And together with all the other information, which for a single doctor, is some, or a single medic, right? Because there's not such a big difference at sea, is sometimes difficult to analyze. But with the help of AI, we will be able to predict certain situations, illnesses, etc. For example, like Susie said, with fundoscopy. But yeah, it's not just to do the fundoscopy, but you have to understand what you see. And not every one of us has the privilege or had the privilege to go through such an intense training, especially nowadays where we're dealing more with bureaucracy rather than seeing real patients. So having the privilege to get trained on using a fundoscope and interpreting what we see. But what I was trying to say is hands-on medicine together with technology will help in the future to support doctors, because I don't think that we will see MRI scanners at sea, but we will see technical support, software support, and this will be a game changer. And yes, your ultrasound example is a very, very good example for minimal invasive diagnostics in rural and remote areas, wherever you are. Can be in the mountains, can be in the desert, or on the ocean. No difference.
Yeah, and thank you. If I may say, starting from January 26th, it is mandatory for all cruise vessels to have an ultrasound machine on board. It wasn't mandatory before, but it is now as an agreement between the CLIA. CLIA is the association of all the cruise companies in the world, and IMO. And so now we have, and obviously all the ship's doctor, they had to undergo a training to use this ultrasound technology. In my company, we have the Butterfly Pro, and it's a very good one.
Maybe we need to add something to our austere and pre-hospital ultrasound course that includes the offshore as well.
Absolutely.
So this May, we are running our first 5-day course for a private organization. What are we teaching? What's on this course? Why are we doing this? And what are the things we're doing in the 5 days?
Well, first of all, we have to teach the medical responsibilities of ship officers, because they have to know what they're being asked to do on board. And on-board medical organization, because you were talking before, Aris and you, about the relations with our colleagues and nurses. But ashore is different than on board. On board, we have a tight organization. We have to refer to captain, staff captain, obviously HR, concerning the crew, and the other players that are on board. So we have to know that we have to relate with them. And then which one are the top 10 medical emergency in maritime medicine? And what are the relations with the International Health and Safety Organization and regulations? And then, of course, these 5 days, because we have to give, but maybe Aris and Aebhric can talk better about it, the international courses that are needed to be a ship doctor, like the ACLS, PLS, ITLS, and a little bit of surgery.
Okay, that's very, very, very well summarized, and I suggest everyone to have a look at the website where the course is. But there's something I want to add, which is I think as important as technical skills. So we also teach two other things, which are, I believe, the most important part. It's team spirit and ethics. Because if you are an Aebhric who is an ex-special forces he knows what I'm talking about. Also, Susie, team spirit, work in a small team for weeks, sometimes months. This is extreme situation. Okay, people you haven't chosen. Okay, they did not choose you. You are put together in a team, and you have to deliver, and you have to protect the health and the lives of many on board. And therefore, team spirit and ethics, the ethics of providing care, the ethics of care without boundaries, okay, for everyone on board, because there's also, you know, everyone knows it. This is so seafarers or people on vessels are protected. Uh, there are a lot of international laws protecting those souls on board. And yes, so we try also to add those two very important topics to our list: ethics and the working in a small team over a long time. Thank you.
Dr. Aris, Dr. Susie, both of you are professors. So we are an academic organization, and we are bringing academia into the offshore medicine. We have our faculty now of offshore and maritime medicine. Where do each of you see the future of our new faculty? Where are we going?
Well, if I may, so that Aris, that is the director, can close our podcast. For me, diversity is an asset. Is a challenge, but is an asset. And to have crew and passengers for so many different nationalities is a gift. Every time I learn something, and we can teach something to the other doctors that are going to be there after us. Because intercultural medicine, for me, is the future of medicine.
And for me, I just want to add that the College of Remote and Offshore Medicine is a natural home to our faculty, because Aebhric, you are the Dean Emeritus of this college, was always dedicated to the highest standard of hands-on teaching, but also to academia. So, for example, many may not know, but the College of Remote and Offshore Medicine is offering not only courses, but also master programs and even doctorates. So we want to give maritime medicine a new home, a home which may start small but will grow, and it will grow with all the faculty to come, and with all the alumni of students to come in the next years. And I'm very honored, and I'm fascinated by the idea to be a part of this, both clinically and academically. Thank you.
Dr. Susie, Dr. Aris, thank you for your time, and I am honored to be walking these halls with you. The two of ye are pillars in the community.
Thank you, Aebhric.
Thank you, Aebhric and Aris, who started all of it.
Stay safe.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at corom.edu.mt.